All right, switching gears now to a medical condition that affects women every day. It's called polycystic ovary syndrome, and in some cases the symptoms are very uncomfortable. But today we have the story of a local woman who is living with PCOS and decided to be public about it and help others who have it. Here's more for today's In Depth. All right, Dr. Trolice, I want to start with you. How many people and who is affected by polycystic ovary syndrome?
Right, well, more than most people realize. Estimates are anywhere from 6 to 20%. So we could actually, Eric, see up to 1 in 5 women suffering with PCOS or polycystic ovary syndrome. And it's a big, big problem for them. They suffer through this because of so many different medical issues that result. It's not just infertility, although it's the #1 reason that patients don't ovulate and probably are not being able to get pregnant, but they have issues of unwanted male pattern hair growth. They have risks of prediabetes and diabetes, high blood pressure, elevated cholesterol, body weight issues, depression and anxiety, and even uterine cancer.
What is the age range for people who would live with this?
Yeah, excellent question. PCOS, we call it the most common hormonal problem in reproductive age women, but women are born with this to some degree. There's genetic basis, there's exposure when they're inside their mom to particular hormones like testosterone or even anti-Müllerian hormone. So they manifest it sometimes even before puberty, but then certainly during their years of reproduction with infertility and the other issues of abnormal uterine bleeding, but this continues for the rest of their life.
Sasha, we saw you here last year at this time, and we're glad you're back. And you're living with this and living with the effects of it. What has it been like?
So I was diagnosed with PCOS in my late 20s when I presented to my OBGYN with my periods had stopped. And so I presented to my OBGYN, she ran tests and diagnosed me with PCOS. Now she dismissed my concerns of not having my period, and Dr. Trolice can probably speak to why we need to have our periods regularly.
Sure.
And I felt dismissed by my OBGYN, who then referred me to an endocrinologist who further dismissed me and told me to come back to see him after I've lost weight without giving me any tools or advice on how to manage the syndrome.
Up to a lot of women, a lot of percentages of women take 2 to 3 years before they're diagnosed and being able to get management and treatment with PCOS because of the lack of awareness and the understanding of the diagnosis, even amongst physicians.
Yeah, and that's a gross underestimation in my opinion, because many of the women I come into contact with, they went decades without getting a diagnosis. Some people still go undiagnosed with the classic symptoms of PCOS.
But you felt like you were dismissed by at least one doctor?
Multiple doctors and other healthcare providers who told me to lose weight and come back to see them. And
please.
Yes, they told me to lose weight and come back to see them after I've lost weight. And my health insurance at that time would not pay for me to see a dietitian because I wasn't diabetic, the very thing I was trying to prevent. If you know anything about PCOS, 50% of women with PCOS will become diabetic or pre-diabetic at an early age, in their teenage years, 20s, before age 40. And this is according to the Centers for Disease Control and Prevention. Ovulation, insulin resistance, these are some of the drivers for many of the symptoms associated with PCOS.
I want to talk now about something that you've really spearheaded, the PCOS Challenge, the National Polycystic Ovary Syndrome Association.
Yes, so after my own diagnosis with PCOS, it became a defining moment in my life. I realized that I had to take control of my own life, but I also realized that there were millions of women and girls and their families who are struggling with managing this disorder and even getting accurate information. So this is where PCOS Challenge was born, with the aim to provide evidence-based information to the PCOS community, but also healthcare providers. If you are a healthcare provider who who see women, you see women with PCOS.
Dr. T, let's talk about the big event that you have planned.
Yeah, this
over the
is
weekend.
amazing. This is unprecedented in this country. I wanted to preface this by saying Sasha and her husband William are heroes because they've taken the patients who felt that they had nowhere to go to get support and understanding, and now this is a national event. They have 5Ks all over the country. I was honored to be put on the board this year, and I would do anything for them. This weekend is huge. This Friday night, we have a black tie gala that is going to raise money for awareness and research. On Saturday, there is a full day of patient symposium education, as well as a concurrent session for physicians to get continuing educational credits. And then on Sunday morning, we have a 5K run. So this is an amazing weekend, and we want everybody to come out.
And so I'm sure you're hoping to have more awareness about this. You know, maybe fewer doctors would dismiss the patients and look a little bit more closely at PCOS, which is something real that people live with, like Sasha.
Yes.
Dr. Trolice, thank you. Sasha Adi, thank you very much, both of you, for coming in to shed some light about this. We're going to, obviously, we'll probably have you back next year ahead of it. It's a very important topic. Glad you could go in depth with us. Thank you.
Thank you for
Eric.
having us.
Right.
Thank